I am a great admirer of AAPG, the All Party Parliamentary Group, because I think this is a group which is trying to encourage pluralism in knowledge systems, particularly in health, but also in other areas into the UK. And I think pluralism has a very, very important role to play in the current context. As we know that in the context of COVID, the fact is that today all the strategies that we are using are really, in some sense, shooting in the dark. We have no by the knowledge system that we use. We want an antiviral treatment. We want a prevention uh, for this particular virus, and we have neither. And so, all the strategies, all the solutions that are currently being used are repurposed drugs. And of course, there is nothing at all available on the prevention front. At the same time, we are barring other mature knowledge systems, and that's where the role that AAPG is playing is admirable. We are barring and preventing other knowledge systems from contributing. Let's face it that at least in areas which we call hotspots, and I think it may be the case in the UK, it certainly is happening in India, we are now entering a phase of community transmission. And the scale at which the virus is naturally spreading, as its nature is so huge and so rapid that I don't think any healthcare infrastructure, particularly an infrastructure based on a single knowledge system, can really cope with the scale of the pandemic and with the incomplete solutions that we have at hand. It is really time to open the doors. The key thing in this is not really going to be that vaccine. That vaccine will be a vaccine for a particular virus. But as we know, that this whole condition is an environmental, has arisen from our incursions into the environment. It's a zoonosis origin. It is an origin from our destroying nature, and it is a spread of or microbes that live in wildlife and coming into human beings. Today we have this virus. Tomorrow we may have several more because of the damage that we are continuously creating on the environment. And therefore, a particular vaccine based on a theory of antigen and antibody for that particular antigen is certainly not going to suffice. We have to build a program for general immunity, which is not virus specific. I mean, for virus specific, it's fine for this particular situation. And, I have no objection to something like that coming up to deal with this. But I know that tomorrow it will be of no use when there is the next kind of microbial attack on our population. And that's bound to happen. We can see that whole experience from the Spanish flu till the SARS that happened in between. They're all of zoonosis origin. So we can see this transfer of, due to our damaging the environment, we can see this transfer of microbes from other life forms into the human life form, creating the kind of damage that they have. Now, I think that if you are looking for a solution for prevention based on building general immunity, then really biomedicine has no answers to it. We know that there is an innate immunity, but there's hardly any research that is going on building what I would call systemic immunity in human populations, not immunity against a particular virus, but generally building up the systems, the host's ability to tackle, problems that would keep coming. And therefore, I think it is very important. I was very pleased to hear the remarks of the representative of the Ministry of Ayush, who laid out, the various programs that India is now officially executing, uh, both for looking at the role of Ayurveda and yoga in prevention, as well as in the COVID context, general prevention, including COVID, but also looking at the role of Ayurveda and yoga in treatment of mild and moderate conditions of COVID. Now, there is a huge track record, both in terms of knowledge systems in Ayurveda and yoga, and in terms of practice that should convince people in the UK. Certainly, it should convince people within our own country that Ayurveda and yoga have dealt with, and continue to deal with complex health conditions. They deal with, certainly have dealt with complex respiratory disorders, and they have dealt with so many conditions which are believed to be of microbial origin. But in the theory and practice of these systems, we heard that brilliant lecture by Nadar, Professor Nadar. There are other ways to tackle a particular problem than the strategy that biomedicine has adopted. It's very, very important that COVID should wake up thinking all over the world on the existence of plural, mature knowledge systems. We should not be looking for solutions from any single system of medicine. Integrative approaches are needed. Professor John Porter talked about the fourth tire. That's a very bold kind of thinking about public health. We need to do this. And I would urge the AAPG to really develop a consortium which involves people who are scientists, people from public health, people from environment, since your space for influence is both India and the UK, and to really create this kind of a powerful consortium in order to convince policymakers that pluralism has the answer, will have the answer much more than any single knowledge system. And that is the strategy that we should really pursue, because as I said at the very outset, currently we are really shooting in the dark, and with no evidence of either treatment or prevention. We are repurposing things and yet preventing other solutions, which in this particular context of this webinar could come from mature systems like Ayurveda and yoga. Please understand that in some sense, it was only 150 years ago. Biomedicine is, if I were to put it in this language, is the traditional system of medicine of Europe. And the whole world has really, for various reasons, and in the history of medicine, you would probably see that there were reasons related to colonialism. that the whole world has allowed this traditional system of medicine of Europe to come and occupy a fairly important space in their own societies. But much prior to biomedicine, there have been knowledge systems like yoga and Ayurveda. And there is, if someone is willing to look, you can see their track records, you can see their current records, you can see the peer reviewed papers that are being published on prevention, on management of conditions. And we are faced today with problems where we are seeing repeatedly, not just in the context of COVID, but in the whole space of, for example, non communicable diseases. We know that we don't really have good solutions. The only thing that biomedicine is really good at, and I'm not intending to attack biomedicine, but I'm just speaking, the facts of the matter, is handling acute conditions and emergencies. In the COVID context, it's the technological role of biomedicine, ventilators, oxygen. That is where no other system has the ability. So it is in handling acute conditions, emergencies, using medical technology. And that's important, that when it comes to a crisis of that, reaches that stage, we need all that. That's what it's good at. But there are other systems which are good at prevention, are understanding systemic processes of immunity, are understanding systemic approaches. And these are not trial and error kinds of things. They are very, very sophisticated knowledge systems. And this is not the place to discuss their sophistication, but there are enough experts around the world who are aware. It is a job now, it is our job, and I consider myself to be some kind of a volunteer and friend of AAPG, that we create a consortium seriously to promote pluralism, to promote various ideas, to broaden the base of healthcare, to reduce the dependency of citizens only on formal health systems, to look at ideas like the fourth tire, where we are building self-reliance in individuals and in communities. And all this is possible in this pluralistic framework. It is not one or the other. When we have emergency, when we have acute condition, when we need that kind of technology, medical technology, I think that biomedicine is the best. And we must, surgery, biomedicine is the best. And we would use it, we should use it. But unless we broaden the base of healthcare globally, not only in India and UK, but globally, we won't be able to do justice to sustained healthcare of global citizens. Thank you.